All this is Dr. Mobeen Sayers on drbeen.com. This is the second question. The question is very interesting from Jan Alderton. She says, Dear Dr. Mobeen, I am interested in the long view for an endemic SARS-CoV-2 scenario. It seems endemic, so when it has just become part of within the nations and communities and it's not spreading outside, it seems logical to me that early and effective and easily administered treatment will be necessary for the significant segment of the population that are immunocompromised. So then she continues with her question. So I am going to talk about that very quickly, and let me share my screen. Okay, so here is the screen sharing. So the question is immune system which is compromised. And the immunocompromise could be because somebody has a cancer. It could be because somebody has immunocompromising viruses, for example, HIV, or somebody is taking immunocompromising medicines and so on, or somebody has, let's say, uncontrolled diabetes. So there are many scenarios where a person can become immunocompromised. Many of us, when we would continue in our age, slowly will become less immune competent as well. So it's not something to um, think that this is just an isolated problem in the society. So this is a very important question, Jan, and yes, I agree with you. Here is what would happen. I'm going to be more realistic today. I know it would make some folks upset. The more realistic is this, that I don't think the authorities worldwide, other than some brave souls and some brave countries and some brave communities, are going to allow IVM use. That seems to be a battle worth having, but at the same time, a battle that is not working, and meanwhile, people are in trouble. So, what I think is going to happen is that the companies that are offering their drugs, which are being approved as we see now, I think those drugs by bigger pharmas, which may be similar to the drugs present outside as well, will become the part of the protocol to manage and manage early. And so this will mean that somebody who is immunocompromised, they will have, and Jen, I'm agreeing with you, they would have the approach of this, that they may have prophylactic medicines. And again, here by prophylaxis, I mean they would take something like, I'm going to deliberately name these things, for example, Pfizer's or Merck's pills, and then vitamin D's and other such things that are necessary to keep them healthy. And then they may actually take, for example, AstraZeneca's antibodies that go on for 5 months and they do not deteriorate and they keep protecting for up to 5 months. These are monoclonal antibodies. And so they may be present. Then early treatment as well. If they become infected, then once again, these monoclonal antibodies, once again, these medicines, we know that there are going to be medicine that will be blessed and medicines that will not be blessed, but these will be present. And I think these will be necessary. So that would happen. And then, of course, we know for the severe cases what other things will be there. Now, how would I look at it? If I just very quickly put the protocol here, regardless of the medicine, I think the protocol should be something like this, that vitamin D should be correct. Vitamin D itself is not a cure, but it is an important immune modulator and optimizer. So vitamin D in the correct levels. Don't overdo them, don't underdo them. That's one. Number two, there will be a need for appropriate vitamin C as well. Again, don't overdo or underdo them, but have proper vitamin C. Then, and this may mean sunlight, this may mean others, there will be a need to have the person be relaxed. This is a very difficult thing. I mean, it's easy to say be relaxed. I was tense a few days ago and many people just said, hey, relax, and I just could not relax. So be relaxed is easy to say, but it is difficult to do. So the problem with the not relaxed or stressful state is that there are epinephrines and steroids that are released that counter the effect of a good immune system's behavior. Then there will be, I think this is very important, monoclonal antibodies, for example, AstraZeneca's monoclonal antibody that can continue to go on for 5 months. This is an important passive immunity in the patients who may not be able to generate their own responses. even with the vaccine, they may not be able to generate their own responses. So monoclonal antibodies will be useful. And then there will be drugs. And those drugs, like molnupiravir. So I know that folks will piravir will become upset that why I'm saying that, but these are the kind of things realistically that will be available. Other things will keep getting beaten down. So at least to save people, we would have to agree that molnupiravir or other pills that would come in with, that there are some other pills that can be added here as well. Then there will be proper hygiene, mouth washes, distances, masks, whatever is doable and is appropriate. I think these all will become a protocol. So this is the discussion. Once again, thank you very much for listening to this. I'm now going to go back to see the next question, and then we'll come back and discuss that question. But Jan, you're very correct. This protocol would start becoming evolved very soon. This would be probably called an endemic protocol, a protocol for the endemic management of the for the management of the endemic SARS-CoV-2 in immunocompromised. Just like we have protocols for long haul early treatment, this will be the protocol. And Jan, this credit goes to you to initiate this discussion. So once again, thank you very much. Please like, subscribe, and share. There are links in the description if you would like to buy me a coffee or PayPal or become a patron. I would see you in a few minutes.